Hi, this is Tamika Chambers, coach tutor for NCLEX, lifestyle coach, integrated nutrition health coach, sharing another priority question today, Tuesday, April the 16th. Here we have a 16-year-old client or patient with cystic fibrosis is admitted with increased shortness of breath and possible pneumonia. Which nursing activity is most important to include in the patient's care? So paraphrasing, I have a 16-year-old client with cystic fibrosis, has been admitted with shortness of breath, possible pneumonia. Which of these activities, nursing activities, is most important to include in their care? And so what do we have? 16-year-old, cystic fibrosis, shortness of breath, pneumonia, possible pneumonia, admitted, and then most important. So we want to capture those keywords because often NCLEX is looking for relationships. And with this one, we're looking at the relationship between a medical condition and nursing interventions. What's priority? So I definitely want to include most important as one of my keywords. All right, so you can go ahead and read the examples as we are the statements here. Are we going to perform? Is it most important to perform postural drainage and chest physiotherapy every 4 hours, or allow the patient to decide whether she needs aerosol medications, or place the patient in a private room to decrease the risk of further infection, or plan activities to allow at least 8 hours of uninterrupted sleep? Go ahead and pause. And if you will, go ahead and decide which answer you choose and why. Always want to look at your rationale, because then you want to look at the question's rationale and say, am I in alignment with the proper thinking? And when you're done, go ahead and resume. All right, so what do we do here? We see that there's a relationship between cystic fibrosis. What is that? Well, that's where they have improper secretion of like mucus, tears, etc. And this stuff becomes plugged up. It plugs up their tubes, their ducts, and can actually could cause an issue, because also too, when we think about mucus, we think about our body, warm, moist areas, and mucus, it actually breeds an environment for infection. Right? And so often people go to plan activities to allow 8 hours of interrupted sleep because they think they're tired, they're coughing a lot, but that's not the most important activity. Place the patient in a private room to decrease the risk of further infection. There's something that needs to occur internally, right? And then so allowing the patient to decide whether she needs aerosol medications. Yeah, we're thinking independence, that's good for nursing. But here we have someone who is short of breath, ding, 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 and possible pneumonia, at risk for infection. So the biggest thing we want to do is help break up that mucus so that we can get them to cough that up, get that up, and decrease their risk for infection. So the answer would actually be A. And I'm going to go ahead and just kind of close in here. So again, one of the critical things we have a respiratory issue. They're having shortness of breath. We want to get them cleared as much as possible so they can breathe better and also decrease their risk for infection. Always read why the other answers are incorrect, as I would tell my clients, because then the rationales increase your knowledge. They can often help you to answer other questions, and it tells you what you don't know. So make the best of every question. Remember, it's not a race to the end. We're looking at how many questions did you get right? Even if the timer goes off, how many questions did you get right? So maximize every question. Understand what the question is asking you. Look for relationships. Look for keywords. I also too still have my notes on Essie if you need any additional support. And I'm also too accepting new clients for tutoring. Hey, you guys, take care of yourself. Have a fantastic week.